Welcome to Forward Thinking Government, a Federal News Network series sponsored by Maximus. I'm Vanessa Roberts, and today I'm joined by Maximus Kelley Harar. She's the Vice President for Federal Health at Maximus. It's great to see you, Kelly.
Glad to be here. Thank you.
So today we're going to really dive into how DoD and VA health organizations can help their patient communities successfully navigate personalized care. It's kind of a tricky and difficult topic right now. That's a big expectation, right? But meeting that expectation is also complex. Agencies are contending with fast-moving technology, significant data and cybersecurity pressures, a need to upscale their workforces, and then back to expectation that that information and those benefits will be accurate and delivered in a timely manner. So let's dive in. That's a lot. We're going to cover a lot.
That is a lot. And we appreciate the opportunity to talk to you about this because it is so important. And we are in the perfect storm, if you will, of federal health care right now, especially with the Department of Defense and the Veterans Affairs. And what we look at every day is how can we make the system better? And we're not doctors, we're not providing direct care, but we can make a huge impact on, one, all of the technology issues and the issues that our customers are facing. But I would say the thing that we also need to address is the cost of healthcare delivery, which has gotten skyrocketed out of control, as you know, and is in the headlines even today as we speak. And so one of the things that we look at is how do we improve the healthcare delivery system? What is it that we can apply from a technology perspective that makes delivery better? Well, Kelly, what is delivery? Delivery means working with our clients who are administering these programs, and it's also ensuring that the beneficiary who are on the receiving end of these healthcare programs are getting what they need in a fast, efficient manner. And we have to use technology in order to do that. And so what we're starting to do is think about how do we create a health delivery, federal health delivery ecosystem, and using technology and our delivery principles to create an efficient manner. That was a mouthful.
Well, you talked about that cost factor, which is a huge piece of it. It's a huge piece that spread across every person, and either whether you're building it, whether you're helping agencies build it, or whether you're that recipient. So maybe it's not $1 million question, but it's not nothing. Where do agencies start? Where should they start?
Great. That is a really great question because I guess I'm old and I've been around on multiple generations of some of these VA and DoD healthcare programs. And so now, as we look at the requirements, we see federal agencies adopting technology. And so where we were working on something in 2016, which was very manual in nature, we may be looking at requirements that require us to use AI, that require us to operate within a secure boundary, that require skill sets that are higher level than before. But you can incorporate technology into all of that and streamline your delivery to make it more accurate and for a reduced cost. And I think that's really exciting about what we do, because you're creating a unified, if you will, care platform for whatever healthcare delivery service you're delivering, and you're allowing beneficiaries to access the care, and you're also allowing the stakeholders, the government federal agency that manages this program, to understand and track real data. And so we have so much data with the healthcare programs that we provide. We need to start incorporating it together and be proactive when we are serving our health customers with that data. It allows us to do pre-consult. We can flag, for assessments, for example, we can flag where we think we need to really focus because maybe last time the service member, their eyesight was going a little bit, and so now we can flag that and we can go right to that. We can use AI documentation at the end of the encounter. That takes the administrative burden off of the provider. And I think it just increases the quality of the care receiving and the timeline in which the service member or the veteran receives the care.
Let's talk about a couple things that came up during when you were just talking about this. One of them is personalization, right? Because you're actually talking about individuals here and that care for the individual. You also brought up data, which is such a critical element. And then you also brought up some of the technology and tools. So maybe talk a little bit more about how things like analytics, machine learning, and interoperability are improving the ability not just to personalize based on that data, but also to like help see what's coming down the road.
Great question. I'm going to start off with an example and see where we go from there. In today's world, a patient could be seen, they could have a fall, they could go to the ER, and they could be seen in that ER encounter outside of their health database or outside of their health system. So what we can do now using data flows and data migration is we can take that encounter that they had in the emergency room and it goes automatically into the system. And so, for example, I had this issue and I had a fall and I had to have stitches. And several months later, I was at my annual primary care visit. That encounter data was in her record and she asked me about it because she wanted to make sure, were there anything, do we need to watch for anything? Do you need any follow-on care? So I see that technology of interoperability among systems as a critical point. Never before in my life would my primary care, doctor or, my kids growing up, would their gen med physician in their annual physical ask for something, ask specifically around that. Where it helps service members when we do readiness exams, it speeds up the assessment visit because you've already gone through the records. And then what we want to do with that data is we want to put it in their health record. Because let's say they're doing their annual periodic health assessment and they're getting their audio test or their hearing test, if you will, or their eyesight. And it may not be registering that it's a problem at this point. So their readiness, their exam goes through, they go do what they need to do. But then they're in their annual report and their general medicine provider sees this and then sends them out for a referral. So that they can make sure that they're monitoring their hearing or their vision or whatever the case may be. Right. So it's really about that longitudinal health record. How do we keep track of it? How do we make it accessible to the people on the delivery side that need access to that information and secure? And how do we make that information secure and accessible in an easy manner to the patient or beneficiary?
Right, and that personalization is that's around whole health, right? Like that's the idea of whole health. Maybe talk more about that and kind of the lens that you and the people you work with at Maximus have been putting on these projects through whole health.
Well, the lens is getting bigger and bigger, I have to say. But through technology, it is getting easier and easier to focus on that big picture, if you will. And so we can use information from the data that we collect from encounter data. We can use social and other streams, behavioral aspects, and we put together all of these data points through our systems, and that really creates the ability for proactive healthcare. And just going back to my example, I might have an issue in my shoulder. Well, maybe my primary care doctor in my visit would say, hey, Kelly, we better get an MRI just to make sure that your shoulder's okay from that fall from several months ago. So it really allows us to take a look at that whole health picture. And it's so important, I think, for people, beneficiaries, to take care and manage their whole health, if you will. And then that way, by having an understanding and appreciation for some of those early signals, then you can take proactive treatment, and then that saves costs downstream. And I think diabetes is probably a perfect example of that, right? We all get our sugar monitored every year by the annual checkup. And so it follows that. And so you're able to make, if you start getting up on that borderline of you can make the lifestyle changes that you need to make in order to prevent yourself from going, further into a diabetic case.
Does that also engender trust in the healthcare system? Because there's a bigger, like you hear your actual healthcare provider that you're with at that moment, or maybe you're on the phone with the, benefits assistant at the VA, right? Does it create more trust because they have access to a bigger picture? They're actually speaking to them very personally about what's happened in their lives.
It really, really does. And I think that's keeping the patient in the center of the healthcare system is critical. We love to use technology. We love to use buzzwords. I'm trying not to use them in this interview because at the heart of what we do and at the heart of what we deliver is a patient there. And they may be going through a healthcare episode where they need that support. And, once again, I'll tell you, accessing the medical system at times can be challenging. I, do my annual checkup and I like to have my diagnostics and my labs run beforehand. Well, for the life of me, I could not get my doctor's office, their AI assistant, to order me my diagnostic lab before my visit. She thought I wanted my lab results. And so I'm stuck in a circular reference with, I forget her name, Annie, the AI robot, and I'm trying to get my labs. And so I went into my doctor's office sort of frustrated because I did get a technology glitch, right? And at the end of the day, by her having that information about my fall, about, really spending time with me and going through my personalized record, I had developed trust. And so I think it makes a big difference. And I'm just, speaking from my personal experience.
Let's back out a little bit and look at it from the other perspective of, of the agency writ large, of the services. We've kind of, referred to readiness and preparation that military officers have to have. But that's bigger picture for an entire unit, for the entire military service. Talk about how operational readiness plays into this and kind of where you see things like AI-driven triage or digital diagnostics and predictive analytics, because that plays into, are we able to do what we need to do as a service?
Absolutely, absolutely. And that's where when we work with these kinds of services, we have to really work at scale, right? And so we've got to be able to synthesize, intake the information. What is it that we need to do? We need to organize ourselves around all of these service members or veterans that need a particular service or assessment. And we need to work it at scale. And so you cannot do that unless you have a holistic system, if you will, that can provide the intake, that can read through this information. We use predictive analytics to really look at the information that we're receiving. We flag where we need to focus on. We do the assessments. At the end of it, AI and machine learning can then help document. It can help flag things, and it improves your quality. So as you look at the military or the VA systems, which are huge scale, we can, by taking a modular approach in what healthcare service needs to be delivered, allow easy access for both the beneficiaries who need to receive that assessment and the commanders who are ordering those periodic health assessments. You're working it from both sides. The reporting is critical to the VA and the DoD, and getting the assessment done and all those check boxes, those are important to the service members so they can complete their mission. And by offering different channels through telehealth, I think we've seen lately where periodic health assessments can be done on your phone, right? And that information is delivered into the system and reviewed by examiners and medical professionals. There's all sorts of ways that we are cutting the time and driving efficiency into the systems so that our soldiers can be ready, so that our veterans can get those benefits that they deserve.
So you hit on efficiency, and I was going to bring up effectiveness too. Are there some small examples that you can show or talk about where you saw how that really played out in reality?
Yes. I would have to say that we all get tired, and the service members and the veterans especially, with their logins, right? So you have various logins to do this. You have another login to do something else. You have another login to do yet something else. And so where you can apply that is starting small with an agency and say, I want to alleviate the redundancy that we have in accessing your systems, DoD or VA. I want to take it and I want to have one entry point. And I want our systems to capture that information up front that is critical, right? But I want it to transfer through the encounter. I want Social Security, I want all the information to move right through our system so that our veterans and our service members are not constantly repeating their PHI, PII, phone number to call me back on, those details. I want to make it seamless throughout the system, no matter what service or area they need to access.
So we haven't even touched on this, but cybersecurity is a huge piece here. I mean, we're talking about a lot of personal information. It's directly tied to people, specific people. Talk a little bit about how that plays into it and that challenge, and still making it not a hurdle to get that access to ensure that that data is safe and to continue that trustworthiness that we already talked about.
Absolutely. So Maximus has been in business for 5 decades, as you know. And so we have had to have our pulse on PHI and PII and keeping that information safe, right? So what you're talking about and what we're talking about today is the safety of our service members. And so how do you bring that to a higher level of information assurance security? You have to pick and choose your battles, LOL, but your battles in cybersecurity, right? What information needs to be protected at that higher level, and how do you work that as a system within your system? Again, you've heard me say modular a couple times today. I think I almost said it right. But we have these components in our system, right? And those levels of security, and we have to have interoperability within those levels of security within our system, because we don't want to create a bottleneck because of the security. We want to create efficient flows. And so you really have to understand the mission and what data needs to be protected at what level.
And that also plays into resiliency, right? Because if you're absolutely having a zero trust environment and you're providing that modular security and you're controlling access based on identity, whether that's on the agency side or it's on the recipient or the patient or the service member side, that's how you get there, right?
Exactly.
So before we go, let's do a little crystal ball. There's a lot of, we said we weren't going to use buzzwords, but there's some generative AI, predictive modeling. You've talked about that a little bit. Virtual first ecosystems. We haven't used that word. We've been pretty good. Talk about which or any of these things or other things that you think are going to really be so impactful in the short term and maybe a little bit in the long term in this environment and allowing better navigation of personalized health.
That's another big question.
I like to close on a large one.
It's really hard for me to pick a technology capability among what we just discussed. And as we know, Time has declared the fathers of AI as, person of the year this year, right? So, you lead off with AI in almost everything that you do these days, and that's a game changer. I think predictive analytics is another game changer. But to get AI and predictive analytics to work, you've really got to have that database and that data scheme and those data flows to pick up all of that information correctly. So I would say it's the convergence of all 3 of those. And I think I know we're supposed to close on technology, but what I would remember is we have to have that human in the loop. Not coming at it from the patient's perspective this time, but coming at it from the back end, right? If we are not using our humans to validate and ensure, to create that trust all through our systems and our delivery, you cannot do it without human intervention, if you will.
Obviously what you're getting at is this scale issue. You talked about it earlier. It's a scale issue in the federal government, right?
It is. And how we're able to ensure that the data is securely stored and gets to the right person at the right time is critical. And to do that, we have to have humans. We use the term human in the loop. Well, what does that mean? That means there are medical professionals reviewing quality. That means there are universal agents reviewing transactions, looking for anomalies, and really ensuring that our systems are secure, but that they're also accurate.
Accuracy is like the critical component. That equals trust.
Absolutely.
Well, Kelley, I want to thank you so much. We actually did cover a ton of ground in just 20 minutes today, so that was awesome. I'm Vanessa Roberts, and I've been talking with Kelley Harar. She's the Vice President for Federal Health at Maximus. To learn more about how you can keep making forward progress on your agency's transformation journey, go to maximus.com. You can also visit federalnewsnetwork.com and search Maximus. Have a great day and see you soon on Federal News Network.